In this video we will tell you about what is bioidentical hormone replacement therapy. Bioidentical hormones are just one type of man-made hormones available. Of all the hormones out there, the bioidentical type is the closest to the real thing. These hormones are chemically identical to the ones your body makes, so you can absorb them easily. Bioidentical hormones are made in a laboratory and can come in different forms. Hormones can come in different forms like pills, patches, creams, injections, and gels. Hormones are chemicals that are made by your endocrine glands. Hormones control quite a few functions in your body such as metabolism, reproduction, growth, and sexual functions. Bioidentical hormone replacement therapy can be used to treat men and women when their hormone levels drop or become imbalanced. It's most frequently used to ease symptoms of premenopause and menopause. It may also be used to improve symptoms of cancer treatment or to treat conditions such as insulin resistance, adrenal and thyroid disorders, osteoporosis, fibromyalgia. Bioidentical hormones are man-made hormones derived from plant estrogens that are chemically identical to those the human body produces. Estrogen, progesterone, and testosterone are among those most commonly replicated and used in treatment. Bioidentical hormone replacement therapy can help in the following conditions: weight gain, mood swings, hot flashes, vaginal dryness, night sweats, low energy levels, memory loss, difficulty in sleeping, decreased interest in sex, or loss in libido. Side effects of bioidentical hormone replacement therapy are weight gain, fatigue, bloating, spotting, cramps, increased facial hair, acne or changes in facial skin, headache, tenderness in the breast. Hormone replacement therapy may not be safe in the following conditions like blood clotting disorders, cardiovascular disorders, breast cancer, stroke, and other heart conditions. Stay connected for more healthy updates. Do like and subscribe our YouTube channel.